is now offering direct family care. And before you get thinking Dr. Noe's a James Bond villain, I can assure you she is not. The patients on her insurance-free program commit to pay an age-based set monthly fee for 12 months to receive highly personalized, direct medical care, same-day scheduling, no wait time, and best of all, after-hours access for urgent health care needs. And we've got Dr. Noe right here in the studio. You don't look like a James Bond villain to me.
More of a James Bond fan. How about that?
How about that? You could actually be a James Bond girl.
Well, I'm not sure about that, but I'll take the compliment.
Okay,
Thank you, Dana.
We're going to take it. All right, tell us about yourself and how you came to come up with this idea.
Well, first, let me say that I am a dual doctorate board certified family physician who is also an author, speaker, and entrepreneur. And I help individuals who are so tired of the hassle of insurance and
that would be me.
Not being able to get the health care that they are paying for because they can't afford to it. And I help these individuals to have access to high quality health care that's affordable so that they can achieve the best and most healthy lifestyle that they can have. And, you know, I've had so much experience with individuals who have come to see me who are paying for really high premium health plans, and it's difficult for them to continue their primary care.
And you don't have any decent coverage.
It's mostly catastrophic, really, for most patients
I know
anymore.
My policy is like a $10,000 deductible, and I get one free wellness check, but that's pretty much it. And then after that, it's if I have a heart attack and I'm in the hospital, I won't lose my house. But other than that, it really doesn't do me any good.
It's really quite challenging because a lot of the patients that I have, they have anywhere from, you know, $1,000 deductible to, like you said, a $10,000 deductible. And just coming in for primary care, because their deductibles are so high, they're really unable to get the kind of care that they need.
Okay, so how did you come up with the idea of direct care family plan? I know there are several other doctors in the area that are doing concierge care.
Correct.
But where did you come up with this, and how are you implementing it?
Well, I can't take any, you
didn't invent the wheel.
Yes, I didn't invent this, so I can't take all the credit for it. This has been around. A direct care model or direct primary care has been around for many, many years. And I've actually considered doing this since I opened my practice 5 years ago. This isn't new. But as I've been in practice, what I have seen is this need for being able to take care of patients in a way that's really affordable to them, that's accessible to them. So more and more, as healthcare has really just been changing and becoming very challenging to navigate, both for the patient as well as for physicians and just really other health professionals. I really just wanted to think out of the box. I kind of tend to do that. I don't exactly go, with the flow most of the time. A little bit old-fashioned that way. My desire when I became a physician was to have that small town doc, relationship with my patients.
And that's on the way of the dodo bird with most people. Who is a good candidate for this? I mean, I know I'm signing up immediately. I've already talked to them and said, the minute that we go off the air, sign me up, because this is perfect for me.
Well, I appreciate that. And really, the people that are good candidates for this there are a few types. One, as we mentioned, individuals with high deductible health plans. However, some individuals are choosing not to carry insurance, which I really don't encourage. I do think, it's wise to have some level of insurance in case you do end up in the hospital. But those that don't carry any insurance, this is also a great plan for them. Also, believe it or not, there are some Medicare-aged individuals who don't qualify for Medicare that, a lot of people aren't really aware of that.
I didn't know that.
Yeah, absolutely. So, Medicare is something that, is a privilege for us in this country, and it's a benefit. But not everyone has worked enough quarters in their lifetime to qualify for Medicare benefits. And so there are some people, for example, anyone that might be an immigrant. I'm an immigrant to this country.
Where are you from?
I'm actually from Trinidad in the islands.
So is Dexter that works with me.
Okay.
I'm very familiar with Trinis.
That's me. I'm a Trini. So as an immigrant, I'm very aware of that. My mom, she lives with me, and she's worked many years in this country, but not enough to build up that kind of benefit. So there are some people that do, find this to be very beneficial to them because they don't qualify for Medicare. And so this is a great option for them.
Okay, I know everybody's wanting to know, I said for one low monthly fee, they're going to want to know right off the bat, how much is this going to cost me and what am I going to get?
Absolutely. So you mentioned a little bit earlier about there are some prices based on your age. And so this plan is for patients age 5 and up. And if you're 19 to 49 years old, you'd be paying $67 a month, which is your monthly, for the benefit.
That's nothing. That's dinner out for 2 people.
Well, absolutely. And it is very affordable. If you're 50 to 64 years old, you'd be paying $87 a month. And if you're 65 and
that's
over,
my category.
if you're 65 and over, you'd be paying $97 a month. And it's really, for many patients, for under, $1,000, they are really receiving a tremendous benefit.
Okay. So what are they going to get during the year that they're paying for this? From my $87 a month, I'm going to write you a check as soon as we get off the air. Mm-hmm. And bingo, what am I going to get?
So what's included in that is 25 office visits.
25? That's 2 a month.
Yes, absolutely.
Who needs to see the doctor twice a month?
The idea is, I could have said unlimited visits, but really,
You do have to cap it for those people that might abuse the privilege.
We kind of have to put a number on it. So really, I don't know any patients that I see 25 times a year or more, even for patients with very complicated chronic medical conditions. But that being said, 25 office visits or telemedicine visits. So that opportunity is there for if there are urgent needs after hours, then they have the ability to contact me and I can help them for things that can't wait till the office is open. Anything that we do in office is covered. You get an annual EKG if that's indicated for you. If you need a joint injection because you have some joint issues, that is indicated, that's covered. Anything that we do in office, abscesses, we do blood work in office as well. And just to let you know, with regards to the blood work, we have contracted with labs to have the cheapest cost to you.
Sure.
And so when you remove the insurance company out of this picture for the patient, you're going to save yourself hundreds of dollars. Someone who is, in their 50s, for example, may be getting at least $600 worth of blood work a year. And on this plan, it will cost you probably less than $60.
Oh God, I'm loving that.
So we just have the patient pay for that.
This so inexpensively?
So for so many years, healthcare has really bundled a lot of services in your insurance premiums, for example, if you will. Primary care has really historically been very affordable. However, if you bundle primary care with things like hospital visits, specialist visits, testing, it becomes more expensive for the individual, okay? So what I've really done is I've removed that part of, care for an individual out of it, their overall health care, and say, look, preventative care shouldn't cost you an arm and a leg, okay? And really a lot of, the government and insurance companies have really relied on the cost effectiveness of primary care to help lower the cost of a patient's health care. We see them frequently. We take care of whatever their needs are, try to keep them healthy, keep them out of the hospital, things like that. And so really primary care has been a source where they've relied on that to lower the cost of healthcare. You remove all the expensive things, hospital, specialist costs, imaging, things like that. It really makes it much more affordable.
It really does. I'm just blown away. Or what about pre-existing conditions and if I have to go to the hospital?
So that's 2 different questions.
Right.
So first of
totally
all,
different things.
With direct primary care, we don't worry about pre-existing conditions. That doesn't exclude you from direct primary care plan. As a matter of fact, if you have pre-existing conditions and chronic medical conditions, this plan is ideal for you.
Ideal.
Okay. As far as the hospital, this is why I say patients really need to have some sort of insurance or should if they can afford it, because those costs are not covered under the direct family care plan. It only covers the care that I provide with all the in-office services at our office.
So if I've got my current doctor, which, I still have to pay to go see all the time, which is what bothers me, and she's prescribing my medications. Once I switch over to you, you'll just start prescribing my medications.
Correct. And we also have the ability to find the lowest prices for the patient. There are some apps that we use to help our patients find the lowest price. And we've even partnered with a local pharmacy to say, look, if my patients come, and they need, a medication for their cholesterol or their blood pressure, will you give them the absolute lowest, price? And that app that we use helps us to identify what that is. And if they match it there, he provides that to them.
Now, do you make these new patients sign a contract?
We absolutely do. That's really one of the ways, that
allows
allows
it
it
to
be
keep the price down.
Correct.
They've got to commit
Absolutely.
for the year.
They do. And, some individuals may not like that, but really it's a commitment that I'm making to you as the patient. And so we ask for that commitment. Now, after a year's contract, they can go month to month, but we are asking for a 1-year contract. It's like a gym membership.
Exactly.
Except way more beneficial for your health. Not that you need to go to the gym. Gyms are awesome.
Yes.
But this is for your overall health.
I tell everybody that I don't refer to the toilet in my bathroom as the John. I refer to it as the gym, so I can say I went to the gym at 2, I went to the gym at 4, I went to the gym at 8:30. Oh, come on.
Hey, it works for you.
All right,
That's
so
good.
how does somebody go to enroll?
So there are a couple of ways you can enroll, but most, our website, which is directfamilycare.com. You can go on there and you can enroll. You can also sign up for a complimentary bonus that shows you the 5 top ways that you can save hundreds and thousands of dollars using Direct Family Care. Also, if you
let's slow down. Let's go over some of those
Sure.
ways. Because what if somebody says, well, I don't have access to a computer, can't go to the website. So.
Absolutely. They can come on in, give our office a call, 813-641-0007. And
Oh, come on. No way.
yes, way. Yes.
Quarter, 4 O's and a 7. I said she wasn't a Bond villain, and she managed to get that phone number.
I did. I requested it specifically. And I always say, my smart patients get it. They're like, whoa, did you specifically do it? I'm like, yeah, that's awesome.
That is so great that you have a good sense of humor about it.
So anyway, they can call our office. They can come on in. But also, any individuals that are listening can actually text the word direct to 324-6655. That's direct. Text that word direct to 324-6655, and you can enroll immediately.
Okay, people are going to say, well, I'm already paying $300 and some bucks a month for insurance. Why do I now need to pay more money for this? And your answer to that is?
Because you have, access with a highly qualified physician that's going to take great care of you. You have accessibility, affordability. This is going to allow you to minimize your use of your insurance. If I can keep you healthier at lower costs, things that I can take care of for you in the office, these contracted rates that we have to minimize the cost of imaging and blood work and medications, why wouldn't you do that?
It makes total sense to me. Mm-hmm. And like I said, $87, that's the cost of a nice dinner out with a couple of glasses of wine.
And so many people pay a lot of money for these Cadillac plans, where they can just, have low copays and, low deductibles. Really, the Direct Family Care plan removes
much money
the need.
They're spending for
Absolutely.
that Cadillac plan.
Yes.
I mean, hundreds of dollars a month, whether you're using it or not.
Correct.
If you're healthy for 6 months and you're paying $800 a month, I mean, 800 times 6, that's just money that you just blew right out because you didn't get anything for it.
Absolutely.
I mean, I would at least make sure I came over and saw you once a month just to see your smiling face because I would know that,
hey, listen, if that's what it takes to keep you healthy, I'm all for that. But I can tell you, I can definitely provide a lot more, options for that. So.
Okay, so this is really good for patients that, or like me, have catastrophic or high deductible insurance plans. Does the Affordable Care Act, does this meet the requirements for that? Because, you have to pay the penalty if you don't have an appropriate plan.
That's a great question, and I get that from patients.
Of course, not that that's actually going to be in effect here now that we have President Trump. Because and it's not just him, it's Congress that they're swearing that the minute that they can do it, they're going to repeal it. But I'm hoping, and I'm sure you are too, for the sake of your patients, are hoping that they're not going to repeal it until they have something else in place.
Well, I do think that there's a need for some, restructuring of what
absolutely.
exists.
And
we'll see. We'll see what comes of that, obviously. But this particular plan meets the need for certain patients. Okay, so this isn't the answer for everyone. But
it does not meet the requirements.
But it does not, by itself, it does not meet the requirements for the ACA. It has to be coupled with a catastrophic plan, a high deductible, high premium plan in order to do that. And I recommend that patients, speak to their tax advisors to really find out the specifics of that. But we certainly don't advise that you go without a catastrophic or high deductible health plan.
Okay, my biggest thing that I think is so positive about this is that you are going to determine the health care that I get, not an insurance company. And I'll give you an example of how this bothers me. I have a best friend. Everybody knows her name's Jennifer. Jennifer was involved in 2 car accidents, which have resulted in her needing to have a hip replacement. She is almost on a scooter. So she went to talk to the orthopedist, and the orthopedist says, yes, we'll schedule you for a hip replacement. However, you have to have the EKG. Well, turns out she flunked the EKG. And so they said, we have to have a stress test. Mm-hmm. And she says, well, I can't walk on the treadmill because I can't walk. She went to and they said, that's fine. We can do the injectable kind, and we can do the stress test for that. Yes. Went to the insurance company. The insurance company says, that's not medically necessary. Just get on the treadmill. She says, have you read the part where I'm getting the hip replacement? That's why I need this. I mean, that kind of stuff just drives me insane.
Right. I mean, listen, the insurance companies, all these third parties payers have really gotten in the way of me and my patients, and their patients, direct access to their physician. Okay. With this plan, what I love is I'm not worried about what the insurance plan is going to say. I'm going to talk to my patient. I'm going to say, look, this is what I think you need. And I will work with a specialist to say, look, my patient needs a stress test. What is the cost of that? Can they just, they walk in, they pay that amount, they get the stress test. It's not going to, it's not a situation where, I have to go through the insurance company. I mean, so much of medicine has become bogged down with the bureaucracies of the rules that the insurance companies and government place on us in healthcare. And it prevents you as the patient getting what you need, and me as your physician to try to provide the best care that I can for you.
Well, that's the most important thing to me, because I've never thought it was right for somebody who's has never even met me, hasn't talked to me, doesn't really know what's going on. And all they're looking at is a sheet of paper that's got some stats and some numbers on it and saying, yeah, we're going to deny that. We don't think she really needs it. Mm-hmm. And you're the one that knows me, interacts with me,
absolutely,
sees that I may be having trouble breathing or whatever. You're the one who goes, no, this is medically necessary right now.
Correct. Yeah. Correct. And I love being able to do that with this type of plan where I'm not really worried about those things.
Now, the only other downside I can see to this is, where is your office? It's in Apollo Beach?
My office is in Apollo Beach. We're located at 6150 North US Highway 41 in Apollo Beach. It's right next to the Winn-Dixie shopping plaza.
Now, there's 2 Winn-Dixies right
there
on
are.
41. So
yes,
this is
it's the one. It's the old Winn-Dixie. It's the one on the corner of Apollo Beach Boulevard and 41.
Okay, and you're right next to the texture room or the chiropractor.
Yes,
there?
all of the above.
The only downside to this, keep in mind, this is Sun City Center.
Correct.
You are not golf cart accessible.
Yes, we are 9 miles for most individuals here, and we have heard that, and I apologize, and but
do you think
I think it's worth
it as this plan expands and you start to get a whole bunch of Sun City Center patients that you might consider having a satellite office over in this area?
Absolutely. Ever since I have been open for, the last 5 years, that has been an absolute consideration, because I realize some patients have that limitation of traveling. And even what to me seems like not a far amount of distance to drive, it is for many patients who are coming to me from Sun City. So absolutely, that would be something I would love to be able to do.
How many patients do you have from Sun City Center? Do you have any idea?
Off the top of my head, wow, that's a good question. So about 40% of my patients are Medicare patients, and so I would probably say about half of them, about a third of them are from Sun City. Mm-hmm.
All right, I think that's time for a satellite office, James. Just saying, I would be thinking about that. Okay, so how does somebody get started with you? I know we talked about enrolling, and then what is the first thing they do? They come in and get an overall wellness check? Do you sit down and go over all of their history?
So really, they can go, what I recommend is they go to my website, directfamilycare.com, sign up.
Directfamilycare.com.
That's
no offense,
right.
But you talk fast.
Directfamilycare.com. Okay. I have been accused of that a little bit, and I think it's the island thing, but whatever.
It is.
Directfamilycare.com. And you can opt in there to receive information. My staff will contact you, and they can speak to you about what's needed. We have paperwork. And absolutely, we want you to come on in and let's get this all started with the initial assessment.
Oh, I can't wait. I am so excited. I really am. Now, you said you're dual board certified.
Correct.
Talk to me about your background.
So, as I said, I moved here when I was 17 from Trinidad, and I actually earned my bachelor's and at Palm Beach Atlantic University, where I was also awarded a distinguished alumni there a few years ago. I earned my master's and my PhD in medical microbiology and immunology and cannabinoid research. And also after that, I went on to academia. Then I went into medical school to earn my osteopathic degree in family medicine. I was our chief resident and intern while I was in residency. And I've really had the opportunity to serve not just my patients, but my profession in different leadership positions. So,
all right, you know that I'm the head of the Chamber of Commerce, so I'm all about business.
Fantastic.
So, if somebody owns a small business, can they provide this as a benefit?
I'm so glad you brought that up, because actually this is awesome for small businesses. You know, businesses that are under 50 employees. It's very affordable. They can contact our office. It's an opportunity for them to provide a benefit to their patients.
At $87 a month, this would be a great benefit for
a benefit to their patients. The patients can remain healthier, and with our telemedicine option, it can not only just improve their health, but their productivity at work. And, you know, all their primary care needs can be met in office. So there's no extra charge to the employees. So it's actually perfect for small businesses as a benefit for their employees.
It's almost like they could do this in conjunction with AFLAC. And then probably the premiums are pre-tax deductible, I would think, just like the premiums for an AFLAC.
I'm not sure.
I don't know.
I'm not sure that's something they can look into, but I really recommend that they give our office a call, go to our website, contact my office manager, and 813-641-0007, and let's start a conversation about that.
Now, you're a big social media girl.
Yes, I am.
Okay. How did you get into all of that? I mean, I realize your age generation, you're a lot younger than I am. You're all over. I mean, everybody, your generation is all over social media. How does that play a part in your practice?
It's huge. I mean, even with it, really the age group, it's across the board. And I've been on, you know, Facebook since I was in medical school many years ago. But really, you know, Facebook, Instagram, Twitter, they can find me at doctor.SashaNoe.com.
What do you say? Hopefully you're not, you know, saying nasty things at 2 a.m. like some people do.
No. I keep it very professional. Although it is me, you know, my patients who know me know that I can be goofy, I can be serious. You get what you see. But they have the opportunity to follow me at doctor.SashaNoe.com, Facebook, Twitter, Instagram, and they can learn, you know, some health tips. Also understand how they can save money with this plan. Just really trying to help them stay in the know with Dr. Noe. That's a blog that I do.
Stay in the know with Dr. Noe. I love that.
Yes. So they're able to just get some great information and stay healthy, and just really have a community where we can talk about your health.
Well, I think this is a wonderful thing that's come to our community. I hope it's very successful for you.
Thank you.
I can't wait to get enrolled myself because I really do need this. And I think a lot of people out there need it. And so this is great, and I'm glad that we could have you on the air.
Thank you so much, Dana. I just want to throw out one last thing. Don't forget to text DIRECT at 324-6655 to enroll today.
I love it. I'm going to do it as soon as we get off the air.